Hello everyone, this is your host Abha Thakur, a fourth year veterinary student. Today we have Dr. Qurat from Department of Veterinary Medicine. Good morning, ma'am. I want to welcome you and our audience to our very special episode of One Health Awareness Talk. And we will be talking about a very important small animal zoonotic disease that is toxoplasmosis. मैम हमारी काफ़ी ऑडियंस पेट ओनर्स पेट लवर्स और वेटनरी स्टूडेंट्स भी रहेंगे आज तो उनके उस पर्सपेक्टिव से व्हाट इज टॉक्सोप्लाज्मोसिस थोड़ा जनरल व्यू उनके लिए
Toxoplasmosis, if you talk about as a disease, what it is, it's actually a parasitic infection that usually you can see in most of the warm-blooded animals, including humans, and because of this, it becomes of the zoonotic importance. The organism that causes the disease is the parasite Toxoplasma gondii. And if you talk about where the disease can be found, it has a worldwide distribution. And even the studies have revealed that the disease has been found to be in half of the world population this time. Okay, now if you talk about half of the world population is affected with the toxoplasmosis, then why can't we see the disease? Why don't we counter the cases of the disease? It's because of its asymptomatic nature mainly. The disease shows no symptoms at all. But if you see the symptoms in some cases, they're of the milder nature. Like you can see the flu-like symptoms in humans. So disease is only apparent when it comes in the severe form. And the severe form of the disease like that is the encephalitis or the ocular damage or pneumonias.
Ma'am, let's start with what is toxoplasmosis and what causes this disease?
Toxoplasmosis is a parasitic infection that affects a range of warm-blooded animals, including humans, because of which it becomes zoonotically important. And now, if you talk about what causes it, it is the parasite Toxoplasma gondii.
कैट जो है हमारा मेन सोर्स ऑफ इन्फेक्शन है
Yes.
और ये ह्यूमंस पे भी स्प्रेड होता है
Yes.
तो व्हाट कॉजेज दिस
When you talk about the cat as a main source of infection, I will tell you why and how. First of all, cat is the definitive host of the organism, that is the parasite. Most of the important stage of the life cycle of this parasite that happen inside the cat's gut. Okay, and if you see any kind of living organism in the world, it needs to sustain itself. For that, it needs to undergo the reproduction, especially the sexual one. And that sexual reproduction of the Toxoplasma gondii, it happens within the cat gut. Okay, and cat, once it releases the eggs, which we call the oocysts, they come into the environment, they contaminate the surroundings and become the source of infection for the other intermediate hosts, which includes the humans. It might be the domestic animals, cattle, sheep, pig, and also the rodents and the birds, which become ultimately prey of the other cats, thus carrying on the cycle of the infection.
एंड मैम हमें क्या क्लिनिकल सिम्टम्स कैट्स में मतलब प्रेजेंस देखने को मिलती है और क्या ये ह्यूमंस में भी सेम सिम्टम्स देखने को मिलते हैं कि कुछ डिफर करता है
First of all, the disease is asymptomatic. If you talk about the clinical symptoms of the disease, you won't find much of the clinical symptoms in the healthier animals or the humans. But if you talk about the clinical symptoms, we see they are of the milder form. In cats, you can find out simple symptoms like there is lethargy, there is inappetence, in some cases vomition, diarrhea, fever also. But if it happens in the severity, higher severity, or the disease becomes severe in the cats, you can see the problems during the breathing. There is muscle weakness in the cats. There are some neurological signs which include the tremors, seizures, etc. But if you talk about the humans, there is little difference, not much, but little difference of the symptoms in them. You will find out the milder flu-like symptoms in humans. You will find out the body aches, muscle aches, fatigue, the swollen lymph nodes, especially those which are in the neck region, especially under the chin, in the armpits, in the groin regions. And if you talk about the severe symptoms in the humans, they are usually found in the immunocompromised patients, those undergoing the chemotherapy, those cancer patients, or those patients who have undergone some kind of organ transplantation. And the symptoms usually are the complicated ones. You will find out the encephalitis in them, you will find out the eye problems, there is the blurred vision, in some cases the blindness can be seen, pneumonias can be there also.
Ma'am, so how it spreads and why are pregnant women and immunocompromised individuals are at higher risk?
Yes. First of all, how does it spread? There are certain ways how it spreads in the environment. As I already mentioned, oocysts are already in the environment which have contaminated the soil. Okay. And I also told that intermediate host can be the domestic animals. So if you take the undercooked or the raw meat, which is already containing the tissue cysts of the Toxoplasma gondii, you get infected with it, first of all. Second, if you are handling the cat litter, especially the pregnant women, the cat litter has the cat feces that contains the infected Toxoplasma gondii oocysts. And when you take these cat litter outside without wearing the proper gloves, then you take these hands towards your mouth, there are high chances you will ingest the infection, the oocysts. And third is the congenital toxoplasmosis. That is, it gets transmitted from the pregnant woman to her unborn child or the unborn baby. And when the baby is born or the infant is born or the unborn kid comes into the world, it will start showing the severe kind of symptoms. That is how it spreads. Now we talk about the second question, that is, why are the pregnant women at high risk? I already told you that they have the ability, pregnant women, to transmit this oocyst, actually the tachyzoid of this Toxoplasma gondii, through the placenta into their unborn kid. Okay, this is one of the reasons. Now talking about immunocompromised patients or those undergoing the chemotherapies. In those patients, you will see the immune system is already weak, it's already compromised, and they do not have the ability to effectively control this disease. Okay, so they will start showing the complicated repercussions in them, or they will show the complications which are life-threatening, like they will undergo encephalitis of the severe form, they will show the ocular damage, they will show the pneumonias, and for such immunocompromised patients, it becomes very difficult to cope up with the infection.
At the end, मैं भी audience को एक message देना चाहूँगी. At the end, you should remember about 3 C's: clean litter, cooked meat, and careful handling. इससे toxoplasmosis can be prevented. And thank you so much, ma'am, for shedding light on this topic and for your valuable time.
Thank you.